Hi class, Dr. Jim here. Chapter 13. Chapter 13 deals with host-microbe interactions. So this is going to be the first chapter we're going to be talking about how microbes and humans play together. And so we're going to look at how they get inside of us, how they colonize us, and how they do some nasty things to us, and kind of look at it from the microbes perspective. The next two chapters, chapter 14 and 15, are going to look at how do we defend ourselves from those microbes, and specifically the pathogens. So this chapter is going to look at how the microbes get in, how they get us sick, and do all these other things. The next couple of chapters are going to look at how do we protect ourselves so we don't get sick and fall and drop down dead from every pathogen we encounter. All right, so let's take a look at these different things. First thing we're going to look at is what is the normal flora. So I've already talked a lot about normal flora in past lectures and that the different types of bacteria we have, the probiotics and that stuff. And so we're going to look at what these things are, where do they live, the different types of things, and that how they colonize us and that. And what I want you to think about is basically any opening to the outside world are going to have microbes. And so we have to discuss where those things are. If you remember back to our first experiment we did in the lab with ubiquity, and I showed you that microbes were everywhere, we're going to find out that they're everywhere. Okay, and so even inside of us. And so we're going to talk about that as well. Okay. The second thing we're going to look at is how and why do we get sick. And so we're going to talk about how microbes get in, how they invade us, adhere to us, the stages of infection, how that happens, and then finally, once we get sickness and then we get better, where do the microbes go after we get done? And so we're going to talk about all these things: entry, invasion, infection, and then exit. How do they get out of us? Okay. We'll talk about where or what are the sources that get us sick. So we'll talk about the little bit of the differences between what is a source versus a reservoir, some of these carriers that are out there. So people that actually carry disease and can pass it from one person to another. You may have heard of like typhoid Mary and things like this. We'll discuss some of that. And then finally, we'll look at epidemiology, which is really the study of tracking diseases and looking and then basically figuring out who's getting sick, why are they getting sick, and how can we fix it. And then again, how do we track disease? So we'll talk about some of the terminology that they use, look at some of the mechanisms, and you guys will actually be doing a little bit of this in the lab, where you're going to be looking at the mortality and morbidity report from the CDC every month and that stuff, and how we track diseases. And so I gave you a little assignment to work on that over spring break, and so you should be able to see how those things kind of work. Okay. So that's what we're going to be looking at for the next for this chapter at least, and then after this, once we get through this, we're going to be going on to the immune system and how do we fight it. All right, so obviously we're not alone. You guys know this from the first day of lab. We went in there and did ubiquity, and we saw that we had lots of organisms growing everywhere. And again, the human body is no different. Okay, we got lots of microorganisms on there, and exists in a state of dynamic equilibrium. I love this picture because it basically shows a person covered in different organisms, and that's kind of how it is. We have more microorganisms on us and in us than we do even have human cells. And so that's one of those things that you have to take. There's microorganisms everywhere and they're all over us, and that's the way that it goes. Many of the interactions involve the human body and microorganisms and the development of biofilms. Biofilms are those films that are formed between the microbes that build layers, and we talked about that in chapter 4 and how they build layers on your teeth and that. And then colonization of the body is always a constant give and take. We want these colonizations to occur when it's good species. When they're bad species, this is when we have infection. And so we'll talk about the difference in those things as well. All right, so what is contact, colonization, infection, and disease? That's basically what we're going to be looking at today. Obviously, microbes that engage in mutual or commensal associations, these are good for us. These are normal resident flora that we have, or indigenous flora or microbiota. And again, we have lots of different organisms that live throughout our bodies. We've talked about this before. Again, that first day of lab, I talked about the different types, the different areas and things that we find. Again, when things go wrong and you get something that's not supposed to be there, a parasite, we call that an infection, which is basically a pathogenic microbe enters and bypasses their defenses, gets into our tissues and multiplies, and that's what an infection is. The pathogen is described as the infectious agent, so you guys know that. And then any disease that is caused by an infection is called infectious disease. Okay, so very straightforward terminology. I don't think there's anything here that you probably haven't seen before, but it just gives you an idea of some of the terminology we use. Okay, when we look at these different things, we see that we have, again, contact. This is when the microbes land on us, okay? Whether that means we breathe them in through our nose, swallow them with our food, or come in contact on our hands and then touch our face, something like that. That's contact, okay? Bringing it to the portals of entry. And we'll talk about what portals of entry, but essentially think of any opening in the body, okay? Sometimes with contact, we get colonization, which is a good thing. So these are microbes that want to live in us and don't cause us any problems, and that's fine. Other times we get invasion where they cross the lines of defense and get into tissues we don't want them to be in. And so I've even mentioned that at the first day of lab when we have organisms that can go from being commensal when they're not really doing anything to us to going into a pathogenic state or a parasite when they get into areas that we don't want. And this happens all the time. Probably more infections happen through endogenous flora. That means microbes that live on us that get into places we don't want to be than getting them from the outside world. When you're covered with things, you eventually are going to get infected by your own stuff. And so that's kind of how you have to look at it. Okay. An infection occurs, so this means that the bacteria multiplies or microbes multiply in the tissues. Okay. You can establish a carrier state, which essentially means now you're passing the gene or the disease on to other people without knowing it. Or if you do know it, like you go to work sick and that stuff, which I know a lot of you do, go to work sick, and now you're passing the diseases on to a lot of other people. Okay. You can also, what happens after infection is that your defense mechanisms, your immune system holds the pathogen in check, and then you fix the damage that is caused and you get better. Or what happens is the microbes result in injury, disruption of tissues, you get really sick, which can lead to morbidity, which is basically real bad sickness, could be hospitalized, might be just laid out for a while on your bed, or mortality, where basically you are dead, you don't survive the infection, these microbes kill you. And so obviously these are two bad states, you don't want this. But it does happen. And again, as you're young and as you're old, as our immune system doesn't work as well at those stages, it can take a much bigger beating than if, in the Middle Ages where we see really healthy, vigorous immune systems that fight off a lot of pathogens. And again, lots of different roles in that stuff. So we'll be talking throughout this chapter and the next couple of chapters about defense and all those other things. But for now, that's basically how these things take place and how they enter in, get into the system, and then colonize, cause infection, and eventually our immune system clears it and we survive. All right, so what are the resident flora? So most areas of the body in contact with the outside world. So you think of any opening to the outside world are going to have microbes, okay? We got microbes in the air, water, and soil. They're going to be on us as well. So anything that's in contact, figure you have microorganisms growing there. Anything inside the body, internal organs, tissues, and fluids should be microbial free. But once they pass that barrier, so when we get, like saliva, when it passes and enters in our mouth, or you think of urine, once it leaves the urethra and other places like that, you're now going to get colonization. So, it's always a limit. Blood should always be sterile. You shouldn't have any microbes growing in your blood. Obviously, that can be something that can be really bad. But typically when we think of fluids inside of us floating around, they should tend to be sterile. Okay? And that same with tissues and organs, anything inside of us that not come in contact. And I'll show you here in a couple of minutes the difference between what should be sterile and what shouldn't be sterile. All right? We do have sometimes microbes that occupy for a very short time. We pick them up from a door handle and maybe carry them over to another spot, maybe on our desk, and then they go away and we never see them again, and we call those transients. And other times we get microbes that we come in contact with them and then they stay with us for a long period of time. Here are the areas down here that show you the normal residence or the sites for the normal residence. And this is the skin and the mucous membranes, upper respiratory tract, gastrointestinal tract, outer opening of the urethra, external genitalia, the vagina, external ear and canal, and then the external eye. So think of any opening to the outside world, you're definitely going to have microbes growing there. Okay? All right, so Bacteria flora benefit the host by preventing overgrowth, and we call this microbial antagonism. I brought this up before, filling space. It's the idea, you get too many microbes in one place, they fill the space, and then you don't have any problems there, okay? The other type, like I said, is endogenous infections, and occurs when the normal flora gets in the places that you don't want it to be. And that happens quite a bit. We get lots of UTIs for poor hygiene, okay? When poor hygiene takes place, bacteria from the colon end up in the urethra, bad news. You get cuts and scrapes. Those things can cause infections where, again, our normal skin microbes that are on our skin don't cause us problems, but once we get breaks in the skin, they get underneath the tissue and then cause infections. So these are all known as endogenous infections, when it's our normal body flora that causes us to get sick. And that's typically when it gets in the wrong spot. When it's in the right spot, it doesn't cause us any problems. When it gets in the wrong spot, that's where you see the problems. All right. So where does colonization take place when you are first born? Okay. So where do these microbes come from? Well, the first microbes you come encounter with is basically during birth. So as you give birth to your child, or as you were born, that was the first experience that you had to microbes as you pass through the vaginal canal. Now, if you did a C-section, or if your child had a C-section, you wouldn't be exposed to the same things as someone that would be exposed to the microbes that are found in the vagina. And so that could change the normal flora a little bit and how these babies are. Now, another thing is that doctors know if a mother has any STDs or any other infections going on in the vaginal area at the time, or the cervix, they will definitely do a cesarean section to prevent any of those things passing onto the baby. So again, that normal, once the water breaks, that's the first time you come in contact with microbes. And so really the first 9 months of your life, if you consider the first thing of fertilization, the beginning of life, those first 9 months you are protected by that amniotic fluid. That amniotic fluid should be sterile, and once the water breaks, once the amniotic fluid breaks, that's when you become introduced to the normal flora. Okay? All right. Here are the indigenous flora to the specific regions. And again, you can pause it here and take a look. I'm not going to go through all these things, but you can see bacteria, fungi. We even have small little arthropods, protozoa, and other things like this. And so there's a lot of different things. I think you should take a look and look at these things. Again, you can pause the video, just take a quick look and that stuff and see. But otherwise, we're going to be talking about a lot of these different things coming up in the next couple of weeks and that stuff. So, but just want you to be aware, there are a lot of different things. It's not just bacteria, but we talk about fungi, sometimes arthropods in the form of dust mites and things like this, and some other things that are out there. Okay, so lots of different things that colonize us and live on us all the time. All right, so the first one is the skin. Obviously, that's the largest and most accessible organ because it's all over us, it covers us, and it does a very good job. We're going to be talking about how well skin does as a defense here in the next chapter, but for now, we know we have lots of microbes growing on the skin. There are two populations on our skin. There's the transients, which is basically a quick, you grab a doorknob, you get some bacteria or microbes on your hand, and then you carry that to somewhere else. They get left off behind after you touch something. They don't stay on your hands any longer, and then they're gone. Okay. The other ones are the residents. These are the ones that live there all the time. Staph aureus, again, it's less influenced by hygiene. The cleaner you are, these guys are not going to leave because these guys have dug in. They know where to hide and that stuff. And no matter how well you clean yourself, they're still going to be there. Okay. And so these guys live on top of the skin. Sometimes we do get infections when they get into the hair follicles and block the hair and oil follicles and that stuff, and that's when we get acne and pimples. We'll talk about that later. But again, normally the skin does a very good job. The other thing we want to think about with the skin is that it does slough off or basically shuffle off or break off after a couple of days, and so we lose that top layer, and along with it go the microbes that are living on those things. So again, those can be microbes that go along with it. Okay. Another one is the flora of the gastrointestinal tract. Now we talk about the upper gastrointestinal tract, so this would include the oral cavity and the throat. Once you get to the esophagus, there's very little that live there. The stomach is a very inhospitable environment because of the pH. The small intestine has some, but not many microorganisms. There can be some that survive there. But by far, most of the microorganisms that we talk about for, like E. coli and that, live in the large intestine, and they're there to help digest, get the water out, and make the solid. And so a lot of your poop that comes out is bacteria along with it. And what makes it smell so bad is the bacteria. And so one of the reasons why people love babies so much is because they smell so good. Well, the reason why they smell so good and everything smells so good is because they don't have the normal flora yet. Once they establish the normal flora, that's when they become stinky little creatures and you don't want to handle them anymore. And so that's one of those things. And you moms know that out there, how you love your little ones for about 6 months and then they start to stink and then you're like, okay, I'm done with them. So, but that's because of the colonization part. The microbes are what make us stink pretty bad. Okay. So think about that as we go along. Okay. Now the normal flora of the mouth, again, this is probably the most unique and diverse flora that we have because we have lots of different things. Lots of things get introduced in our food, in our water, and a lot of other sources. It has numerous adaptive niches that grow in there. And again, the bacterial count in saliva is about 5 times 10 to the ninth. So this is getting into the billion. So that's about 50 billion bacteria cells in there. So lots and lots of things, okay? Actually, I think it's even more than that. No, yeah, it's about 5, or maybe it's 5 billion, something around there. Lots of microbes. Anyways, we're talking billions here, okay? Lots of different microbes just in the mouth itself. Okay, in the large intestine, you can see here's a nice clean large intestine and that stuff. And again, it has complex and profound interactions, and this can have anywhere from 10 to the 8th to 10 to the 11th microbes per gram of feces. So we're talking lots of poop and that stuff. So these are lots of bacteria, lots and lots of things. Again, this is what makes things out that come out of there stink is the bacteria. Again, if you have a lot of gas or flatulence, it's due to the bacteria that you have in your gut. A lot of other things in there, and we'll can discuss that in another time and that stuff. But again, the intestinal bacteria contribute to your odor, but they also are helpful in helping digest and break things down and doing all those other things. And again, not a lot of air in the intestines, so these are going to be anaerobic bacteria in this case. The flora of the respiratory tract. So when we talk about our normal flora of the respiratory tract, we have lots of bacteria that grow in our nose, in our nasal cavity, and down in the larynx. Now, what separates the upper versus the lower? A lot of times people will say the larynx or the voice box is really the separation between the upper and the lower, and that's kind of how we look at it with the microbial world. Most things once above the larynx or the voice box is going to have are full of microbes. When you get down to the bronchioles and the bronchus and that and the lungs, you shouldn't have lots of microbes growing down there at all. So that's really the separation between the two. And so that's what you're looking at between those guys, okay? And so that's what we see. Now, if we look at these things, streptococci organisms grow in both in the mouth and then the back of the throat and that stuff in the nasopharynx. And then we also have Staph aureus that grows in the nasal entrance and that, and then the mucous membranes of the nasal has Neisseria that can cause a lot of problems, and we'll look at that later on. And then the tonsils in the lower pharynx have different strains of Haemophilus. So lots of different things can grow. You look at things like this, and they do a number of different types of infections and that stuff. And so we'll talk about all these different things again when we get into more of the organisms that cause disease. Some of these are normal in that I think it's kind of funny when people have to think about they get strep and they like, oh, I get strep throat all the time. Well, most people have strep in their throat already. It's just you get different strains of strep and that can cause problems. And we'll talk about that again when we get into those infections. But a lot of people are carriers and that stuff and don't know it. And so, again, when we get into the infections and talk about the different types of things, we'll take a look at that. All right, so some of the flora of the genital urinary tract include the sites that harbor the normal flora. In females, that would be the vagina and the outer opening of the urethra, so part of the way. And then in males, it would be the anterior of the urethra and obviously the outside. And so again, once it gets past really the first couple of millimeters and that stuff, you don't really have any microbes growing in. Once they do, if they do get past this, this is when we start thinking about UTIs and different things like this. So normally there shouldn't be any organisms in the bladder or upper urethra, and same thing with males. There should not be really, in most of the urethra and especially the bladder, no microorganisms. Now, sometimes they do end up in there, and obviously for a lot of different reasons. You can talk about also the anatomy and how women are more likely to get UTIs just based on anatomy and that stuff, and that's pretty common. And so those are those things. Also, with women with the vagina, you have changes every month, especially with menstruation and things like this that can change the pH and change different times of the month when different organisms are actually growing in there. And so this can lead to other infections and things like this. But again, typically these areas have a wide range of different organisms that are growing. And again, we don't want these things to get into the wrong spot. And when they do, that's when we have problems. Okay? All right. So we do want to maintain our normal flora. Obviously, that's always important. Our normal flora is essential for the health of humans. It helps create an environment that prevents infections that can enhance host defenses. Again, I talked about this in the first day of lab. They fill space, and if they are growing there, the pathogens can't grow. If you take up all the land, you can't build a house if all the houses are already built and that stuff. And so that's the idea. You want to fill those spaces with good bacteria so the bad bacteria have nowhere to go. And so really in the last 10, 15 years, probiotics have really taken off. And then now you see them as a bottle. You can take probiotics all the time. You can buy these pills, put them in, and then take them. And then you now have a nice bacterial flora that will maintain your infectious or non-infectious health because you want to be healthy in that stuff. And again, antibiotics, dietary changes, and diseases can affect the normal flora. And again, taking probiotics, I've always said when you're taking antibiotics, take your probiotics with it, either eat your yogurt or take a probiotic to maintain that normal flora because antibiotics don't discriminate. And so that's an important thing. Okay? All right, here's your first concept check. So, normal resident microbes are absent from which part of the body? Is it the pharynx, the lungs, the intestine, hair follicles, or mouth? I'll give you a second to think about that. All right, so think about it. Which one would be an internal tissue that you wouldn't expect microorganisms to get to? Okay, if you said lungs, you would be correct. And I talked about that. The lower respiratory tract, again, typically don't have microorganisms growing there. The intestine have lots of E. coli and things, especially the lower intestine or the large intestine in this case. Hair follicles, obviously on the skin, have lots of bacteria. The pharynx, again, that is the upper respiratory and our oral cavity, you have that. And then the mouth. Lots of bacteria in the mouth. So you guys that are going on to dental hygiene, this is what you get to deal with every day, is cleaning the bacteria out of people's mouths because, again, over time, those things build up, and what you're cleaning is what the bacteria have done to the mouth and the mouth cavity. So, okay, so good job if you got lungs. All right. So what happens when we get infected? So we talk about the stages or the signs and all these things and what happens during infection, and we want to look at what happens or what causes us to get infected. Okay? So obviously if we look at this little thing up here, we have portals of entry, and we're going to talk about the different portals of how they get in. It's basically anything that's open to the outside world. The microbes come in, and then they have to get in and stay for a while. Okay, so what happens is that basically once they get into the body, they adhere to the body, then they invade. So they adhere, and then they are able to stay in there, okay, and then they invade. That means their numbers can grow, then they multiply, and then they infect. Okay, and then we talk about infection that leads to disease, and then they can damage tissues, and then finally, whether you are sick and the microbes leave or you die and the microbes leave, that is all depending on how your body responds. But that's typically how it goes with an infection. Most of the time, things come in, but they never adhere, and so that's a good thing. So when we talk about viruses and other bacteria, pathogens, and they get into us, but they don't have space to adhere, we are protected, and so we never have to deal with those things. So you kind of think of after the portal of entry, this is the major crossing site. If they can adhere and start to grow, that's when you go down the stages of infection. But if they can't adhere, you're not going to even worry about it. Your immune system will take care of it, and you don't worry about it. You never blink an eye about it. Okay? What can weaken our host defenses? Well, old age and extreme youth, and again, we'll talk about this with our immune system, genetic defects in our immunity, and acquired defects, and we'll talk about that in chapter 16. Surgery and organ transplants, because now you're opening up the body and now allowing microorganisms to get in, Organic disease like cancer, liver malfunction, diabetes can lead to spread of different things, and diabetes has a very interesting combination with a lot of different diseases, and so we'll look at that with circulation and that stuff. Chemotherapy and immunosuppressive drugs. Chemotherapy targets rapidly dividing cells. What is one of the cells that rapidly divide in your body? Your immune cells, your white blood cells, and so it targets those too. And so if you're going in for cancer treatment, along with if you had a transplant of any kind, you're going to be on drugs that suppress your immune system. Your immune system goes down, and that makes you more likely to get infection. Okay. Physical and mental stress, it is true, the more stressed out, the more tired you are, the more likely you're going to get sick. And then obviously if you're already dealing with an infection, this allows you to set up for multiple infections, and we'll talk about that as well. So lots of different things can play a huge role in why you get sick. Okay? All right, so let's talk about the difference between the two types of pathogens. The first one are the true pathogens, and what true pathogens are pathogens that unequivocally will get you sick every time. These will affect healthy people as well as immune compromised. These are things like influenza or plague or malaria or some of these other ones. It doesn't matter if you're healthy and you have a vigorous immune system or not. These pathogens will get in, they'll adhere, and cause you to get sick. Okay, that's a true pathogen. An opportunistic one is one that only looks for an opportunity to get you sick. What they're looking for is an opportunity for your defense systems to be down so that it can cause you to get sick. Two main guys here, Pseudomonas. Pseudomonas is a nasty little guy. It grows green, it gets into burns, it gets into wounds, it can grow under nails, it can get into your eyes, it can grow almost anywhere, it can get into your lungs and that stuff. And really what it's looking for is an opportunity for your immune system to be weakened so that it can come in and attack. Candida is another one that's a yeast, and again, yeast can cause yeast infections in the vagina, can cause thrush in the back of the throat, a lot of different areas. And again, any issues that you might have with opportunistic infections or things like this can cause problems as well. Okay, the severity of the disease depends on the virulence of the pathogen and the characteristic structure that contributes to the ability to cause disease, and we call that a virulence factor. So essentially, when we say how severe something is, we say it is very virulent. If it causes lots of diseases in lots of people, we say this is a very virulent strain. And we talk about virulence factors are the factors that are produced by that organism that cause you to get sick. And again, we'll talk a little bit more about this, but I'm just bringing it up now as a terminology that you will see, okay, again and again. All right, so we talked about portals of entry. What are portals of entry? Any opening to the outside world is a portal of entry. So we can think of the eyes, the nose, the mouth, a skin if you have a tear or cuts. You can say the urogenital tract. You can say the pregnancy at birth. You can say the intestines or the anus going the other way and things like these. These are all the portals of entries. These are where microorganisms come in to the body. Okay. We have exogenous agents, which are outside the body that then come in from other sources. So an example of exogenous agent would be the flu virus. The flu virus either travels in particles or droplets that you breathe in, or if you grab a door handle and then pass it on to you, that would be exogenous. Endogenous are normal flora that exist in one part of the body. Say that E. coli that's growing in your intestine and ends up causing you to get a urinary tract infection because it got in the wrong spot. Or the staph growing on your skin that got under the wound and now is causing a staph infection in the skin because it got under the skin itself. Okay, those are exogenous or endogenous agents. So exogenous, think outside, endogenous, think inside. Okay, and so that's where these things can come from. Okay, we talked about the portals of entry. So skin, nicks, abrasions, punctures, gastrointestinal tract. So how these get in food, drink, and other ingested materials. Respiratory tract, oral, nasal cavities, droplets you breathe in. Your genital tract, this can be sexual or displaced organisms where again they get into places that they're not supposed to be. And then things can even cross the placenta and cause problems too. And we'll look at some of those diseases as well as we talk about that. I think there's a slide here where that is. Here's a nice little slide to get you guys going and thinking about the number of STDs. You can see that trichomonasis, which is actually a eukaryotic pathogen, that's probably the most commonly transmitted disease. HPV is the second. And again, the reason why you see this a lot of times is because a lot of times they're asymptomatic and people don't know they get these things without seeing them. Another one is herpes, chlamydia, gonorrhea, syphilis, hepatitis B, HIV, and AIDS. And so you can see these guys are down at the bottom. These are very serious. These things people tend to get over and over again because what happens, they get treated, they take an antibiotic, they get treated, and then they go and get it again and again and again and again. And that's why we have these problems. And so one of the things you'll see, especially in inner cities and places like that, if you choose to work there, is you're going to see a reoccurrence of the same people coming in with a lot of the same diseases because they didn't learn the first time, that you don't want to get these things. And so that's one of the things you'll be seeing if you especially work at some of these inner city hospitals and that. All right, another one is the storch. This is the syphilis, toxoplasmosis, and other diseases, rubella, cytomegalovirus, and herpes. All these different diseases have the ability to cross the placenta, which means that the mom will actually get the disease and then pass it on to her child. A lot of the times, mom won't even get infected, okay, or mom won't even feel the symptoms that she is. But unfortunately, these things get in and then cross the placenta and can affect the baby. Now, normally the baby in here should be completely sterile, completely protected, but things can cross the placenta and can have dire straits for the child. And so you can lose the pregnancy, you can have early delivery. Sometimes you can get, again, physical or mental issues that are associated with those things, developmental problems, and that all associated with these different diseases. Now, the latest one that is out there you may have heard of is the virus that's being spread by mosquitoes, and we're seeing this in South America. And so if any of you guys are planning to get pregnant or are pregnant and you go to the Caribbean or South America or Central or South America where these viruses are, I don't remember the name. It starts with a Z and I can't think of it off the moment. So Google the virus that starts with a Z. And if you see that, you'll see that it's become a very big epidemic down in like Brazil and that stuff. They're actually worried about the Summer Olympics and that stuff being down there because of moms that are potentially trying to get pregnant or ones that are pregnant, and these things can cause, again, physical or mental problems with developmental problems in these developing fetuses. So it's a scary thing. So again, just be aware. So if you're planning that honeymoon down to Jamaica or something like that, you want to be aware of these things because, again, if you're pregnant or thinking about being pregnant very quickly, you might have to worry about getting this disease, and this is spread through mosquitoes, and again, it crosses the placenta. So just want you to be aware out there. Google it and you'll see. Okay. Now, what do we call an ID? An ID is the requirement for an infectious dose. This is the minimum number of microbes required for the infection to proceed. So what that means is that if a person gets this number of organisms, they have the potential to get infected. And so some of these have a very low ID, some have a very high ID. When you have a very low ID, that means you're very infectious. You only need a few organisms to cause infection, okay? So if you look at this list here, measles, Q fever, tularemia, smallpox, these all have very small numbers. These are very low IDs. That means you only need one virus of measles to get you infected. That is very scary. Only one virus. You can't even see that virus and it can get you infected. And this is spread through respiratory droplets. And so that's why we vaccinate and vaccinate people. Things like anthrax, typhoid, and cholera, these take lots of cells to get you infected. And so when you get infected with large numbers, it takes large numbers to get you sick. And so typically, these are not as invasive, not as infectious, not as virulent, and so we don't worry about these as much. The caveat to this is like with things like cholera and other things. The problem with cholera is that you get lots of infections and that stuff due to drinking water and things like this that are contaminated, and so you're drinking millions and millions of organisms at a time. And so even though it takes 10 million or 100 million cells to get you sick, you'll be drinking that every time you drink water, and that's the problem, and that you get it over and over and over again. And so when you have endemic areas where cholera is and that you don't have clean water, this is where you see those things. Now, there are some organisms, like the organisms we work in our lab a lot of times when they're the biosafety level 1, these don't have an ID because you can basically bathe in these organisms and they're just not going to get you sick. Okay, you could get trillions and trillions of organisms on you and it still will not get you sick. And so that's a lot of these lab strains that we work with now. I always put that with a word of caution that I don't want you to attempt this because I don't want you to get sick. There's always that chance, but really they don't, you would have to almost drink the whole tube to get yourself sick, okay? And just put it that way. All right, so that's what the ID means. All right, so once you have these organisms come in through the port of entry, they have to adhere. And like I said, that's kind of the stepping stone. If they adhere and get in and attach, that leads to infection. If they can't adhere, then they won't make it in. They're not going to make it in. They're not going to find infection. You're not going to be able to grow, and then you've cleared the infection before it even started. Okay, so what does adhesion mean? Well, we talked about a number of different things on the bacteria, including fimbriae, flagella, the glycocalyxes, that will allow these things to stick. So think of sticking to tissues, okay? So the fimbriae stick to the host cells. Again, the capsules or glycocalyxes, the sticky things that allow you to stick to things, will stick. Those things stick, and then they can adhere and cause infection. Other things like cilia, suckers, hooks, and barbs, these are going to be on more of the eukaryotic organisms, the bigger things. And again, these things allow them to stick to the intestines or other parts of the body and allow them to do their work. Now, another one that isn't on the list is the spikes. And again, we talked about viruses before in chapter 6. The spikes are the keys and your receptors are the locks. If you don't have the right locks, the keys are not going to work. And so again, those keys have to find the right lock to bind. And if they don't find the right lock to bind, the viruses are going to get eaten up by the immune system and go away. And so it takes a lot for a virus to infect. It's got to find the right cells to infect, to get you infected and get into those cells before they actually take over. So there's a lot more to it than just the simple binding and hopefully something happens where it's actually coming inside of you. Okay, so that's the adhesion stage. All right. Here shows you the adhesion properties of the different organisms. Here's the microbes, here's the diseases they cause, and again, here's how they adhere. I'm not going to worry about the specific adhesions of these different things. I think they're kind of interesting. And again, if you're going into microbiology or something, you may want to take a look at these things again and look, or maybe if you've had one of these diseases or something and you're interested, go ahead and pause the video and take a look. Otherwise, don't worry so much about this, but I think it's just kind of interesting so you can see. Again, some of you have talked to me about certain diseases and that stuff, and you can take a look and see here, and it shows you how these things actually stick and adhere. Okay? But again, I'm not going to ask specifics on any of those things. I just want you to know that organisms can adhere to the cells. All right. So, and then I talked about the immune system. Normally, the immune system does a very good job of finding these things and destroying them before they get you sick. However, microbes are very smart. Remember I talked about how they're very smart and figure out ways around things? Well, of course, they have ways to avoid our immune system, and these are surviving the host defenses. One of the things is the antiphagocytic factors. These are things that prevent them from being eaten up. We talked about the capsules around the bacteria. Not all bacteria have them, but if they have a capsule, and that's that sugar coat around the bacteria can't be eaten by the phagocytes. And so that's one way of protecting. Another one is some species produce these leukocidins, which actually are toxins to your white blood cells, so they kill your immune system. Okay. Another thing is the slime layer or capsule, again, making phagocytosis difficult. We talked about that. And then the ability to survive inside. Some of these organisms have adapted so that they allow them to be eaten, and then they don't die on the inside. They avoid getting eaten by or digested on the inside of the cell. And now those cells that eat those things, those phagocytic cells, will carry the microbes around. They break out and then they can go infect different spots. So it's kind of like the Trojan horse effect where these microbes can sneak in, hide, and then release out when they want to and cause more infection. And so these are very smart guys. I told you, bacteria and viruses are very smart. Even though they don't have brains, they figure out ways to get around our defenses. And so this is why we get sick. All right. Once they enter into the host tissues, they can cause different things. And again, a lot of times this is due to what we call virulence proteins. Virulence proteins are proteins or things that are produced or factors that are produced that damage the tissue. And you can see here, here's a salmonella. What it does is it binds to your intestines. It releases secretion factors into the cells, allow the cells to pull it in, and then it works its way through the cells of the intestine and then gets into deeper tissues, which then leads to more systemic infection, and that so it tricks the cells for letting them in. And again, it can damage the host tissues and that stuff. And these are called virulence factors, factors that are released by the bacteria and viruses that cause damage to the tissues. And these things make organisms more virulent or more dangerous or more infective. And so that's what we see. Okay? So virulence factors, these are traits that are used to invade and establish themselves in the host, and they determine the degree of tissue damage based on how many they have. Okay, some of these things that they can release, and we talked about exoenzymes before, these are enzymes that are released outside the organism. These enzymes can go in and damage tissues. One of the great ones is hyaluronidase, which basically breaks down connective tissue. You have DNases, which break down DNA. You have staphylokinase, which breaks down the blood. You got a lot of different these exoenzymes. And again, ending in ase, think of enzymes that go in and destroy cells. Another one is toxogenicity. These, again, are organisms that produce toxins that can destroy the cells. And again, we're going to talk about the different toxins that they produce here in a minute, both endo and exotoxins that get released, and that causes tissue damage as well. And you can see here are the toxins down here below. Bacteria release these exotoxins. They cause damage to the cells and cause the cells to be lysed and released. Okay, so we'll talk about these as well. All right. So another thing, again, the exotoxins. We have two types of bacterial toxins. You have the endotoxins, which are ones that are on the organism, and then you have ones that are outside that get released out of the organism. So typically the endotoxin that we think of is LPS. LPS is that layer around the bacteria, that second membrane on the gram-negatives. That itself can be an immune response. So if I gave you straight up LPS that's been purified, you'll get an infection just like, or you'll get a response just like you got a bacterial infection. This thing is very immunogenic, meaning it can cause a very great immune response to you. And this is an endotoxin. This is stuff that gets into you. The body recognizes it as toxin and can get you very sick. Okay, endotoxin because it stays with the bacteria. An exotoxin is one that gets released. Now, a lot of bacteria release toxins to destroy tissues. An interesting one is like salmonella. Salmonella has these, what we call Shiga toxins. These Shiga toxins get released. They damage the intestines. These intestines then release their fluids and cause diarrhea. And so that's how those work. You also have some that cause, again, these AB toxins, which can cause destruction. This is how anthrax works in the pulmonary or in the lungs. It basically releases a toxin and destroys lung tissue, which eventually kills you. You also have ones that destroy blood cells, and we'll see this actually in the lab when we start measuring for basically clearing of blood or hemolysis. And so if we look for the clearing of blood, we look at hemolysins, which are enzymes or toxins that destroy the blood. And again, we'll talk about this as well as we go into the lab. Okay, so you have endotoxins, which stay with the bacteria, and exotoxins that leave the bacteria and go away. All right, and this gives you an example. Here are the exotoxins. These exotoxins are released from the bacteria, and again, they can affect the heart, they can affect the brain and cause problems in the brain, lots of different things. Endotoxins stay with the bacteria. Again, those things can cause an immune response, give you general physiological effects, including fever, malaise, aches, and shock, and again, can cause serious problems as well. A lot of times these cause serious problems very quickly. So think of exotoxins like the tetanus toxin, which causes you to have basically contraction and lockjaw. Or if you're talking about Botox, Botox is a toxin released by bacteria which causes flaccid paralysis. Those are toxins that are released by the bacteria. Endotoxins stay with you. These are the LPS. And like I said, LPS can cause an immune response all on its own. And so when they're associated with bacteria, they can really cause a lot of problems. All right. Here shows you the difference between an exotoxin and endotoxin. Again, you can look at these different things. I'm not going to ask specifically what's the difference between an endo and exo. The only thing I might ask on the test would be where do you find an endotoxin versus an exotoxin, but I'm not going to ask you specifically any of the targets or anything like that, okay, and what they do. So just know the difference between an endo and exotoxin, but don't worry about some of these comparing and things like this, all right? Okay, here's the concept check. So only gram-positive bacteria can secrete exotoxins. Is that true or false? Okay, if you said false, you'd be correct. Exotoxins can be released by gram-positive, gram-negative. Again, these are all different types of bacteria release these things. Endotoxins typically are normally the gram-negatives because we associate endotoxins with the LPS layer. So that's where you see the gram-negative ones come about. But typically with exotoxins, they're found in all bacteria, gram-positives, gram-negatives, and all different types. Okay, anything that's pathogenic typically has an exotoxin associated with it. All right, so let's look at the 4 distinct phases of the clinical infection. So once we get infected, and again, this is the microbes getting in, getting established, and starting to grow, what happens? And these are basically mimic what you saw with the growth curve. So if you remember the 4 stages of the growth curve, you had the lag, the log, the stationary, and the death. Well, you see kind of the same thing here, but you have the stages of, again, the stages of infection. So again, these are 4 different stages. So the first stage is the incubation period. And the incubation period is the stage where basically the microbes are getting organized. This is when they come in, they get first contact with you, they get into your body, and you don't notice anything. The bad thing about the incubation period is you can spread this disease to other people without even knowing it because you don't know you're infected yourself. So this is the time period when you first get the disease to where you first start to feel any symptoms. Okay, so that can be anywhere from a couple of hours to many years, and so this can be a lot of different time periods involved. And again, it's all about when you get exposed and how long this guy takes to cause any signs or symptoms. Okay. The second thing is the prodromal stage. The prodromal is when you start to feel kind of and we've all felt that way before, where you kind of know that you think you're catching a cold or something's happening, you don't feel right, you may have a headache, you might have the sniffles, you might have something, you just don't feel good, you're kind of achy, that stuff. It's just kind of telling you, uh-oh, I think something's coming on. That is called the prodromal stage, okay? The prodromal stage is basically that stage of something doesn't feel right. You're not really that sick. You're not bent over sick and hurting and everything else and laying in bed, but you just know something's not right. Okay, and that's the prodromal stage. The next stage is the period of invasion, and this is where you're going to have the height of your infection, the height of your signs and symptoms. This is where you're going to feel awful. This is where you're going to be out on your bed. This is where you're coughing, sneezing, and just miserable. Okay, and this is known as the period of invasion. This is where the bacteria or virus makes its peak, and then you finally kind of hit that stationary, and eventually it will start working its way down. Okay, once you start to feel better, you now get into the convalescent period. The convalescent period is basically when it goes down. So that's what happens here. So the convalescent period is when the infection goes down and you start to feel better. Okay, and so that's the idea. So you get to the end, you get down to the bottom, and you start to feel better at that point. Okay, so convalescent period, you start to feel better, everything's better with you and that stuff. Now, the one thing I do want to mention to you guys is that anytime during these stages you are infectious, meaning you can pass the disease. Now, what happens? A lot of times we go to work when we're in this stage. We go to work when we're in this stage, and we pass it on to our coworkers. And if people would just stay home, we'd realize that we could save us a lot of time and effort and people getting sick. However, we know we have to be at our jobs. We want to make money. We need to support our families and everything else. And so we go to these stages. We pass our disease on to everyone. And it's not right for us to be out for 10 days. If the world was perfect, as soon as we start to feel bad, we could stay home for 2 weeks and still get paid and everything else. But that's not the real world. And so that could be the issue. And so we go down. We still are sick at this period. Even though you feel a lot better, you still can spread the disease because basically what's happening is you're shedding that response. So I just want you to know, anytime during those stages you're infectious, okay, you can spread that disease on to anyone. All right? All right. So what are the patterns of infection? So you can have a localized infection, and this is basically if you say you have a skin infection or you have an infection of your tooth or maybe you have an infection in your nose. That's a localized infection, okay? Upper respiratory, that would be localized. Okay, a systemic infection is when it's affecting the whole body. You're feeling awful all over. Think of the flu, your worst flu symptoms. You're basically laid out. Everything hurts. You got a headache, your chest hurts, you're coughing, you're sneezing, you may have a temperature. Everything is going. That's a systemic infection, your whole body. Okay? And sometimes you can get a focal infection. And a focal infection is when the agent breaks loose. So let's say you have a localized infection. And we'll use their example they have here. So let's say you had an infection either in your throat or in your teeth or something like that. And that bacteria can actually get into the bloodstream. So if you have bloody gums or you allow that to get into your body, those things can actually go to your heart. And when they go to your heart, that can cause obviously a secondary infection. And so basically you carry that local infection to other parts of the body. That can be a bad thing. And we call that a focal infection. Okay? All right. We can also have a mixed infection. This is when you have more than one microbe that's causing disease, and a lot of times that can be like intestinal, or if you're talking about things in your mouth, if you have a bacterial infection or maybe an abscess in your tooth, that can be multiple different bacteria there. We talk about primary infection. This is the first infection that you may get. So let's say in this case that they show the primary infection was a urinary tract infection, and then that urinary tract infection allowed you took antibiotics, and that set up a secondary infection, which now gave you a yeast infection. So now you got the double whammy. So a lot of times flu does this very well. So flu causes the primary infection, affects the lower respiratory of the trachea and lungs, and then that allows for the secondary infection, the pneumonia, the bacterial pneumonia, to set in and cause infection in the lungs. And so that's another spot where we see that. So we get the primary and then the secondary infection that can occur. Okay, so primary, first spot, secondary is the infection after the primary. That's caused by the primary. All right, we can also have an acute infection. This comes on very quickly, like with a cold or flu. It can be severe. You can be almost on death's door. You recover and survive, and then it goes away. Other ones are chronic infections. These are lifelong infections. These are things that stay with you the rest of your life. So things like herpes. Herpes is what I always like to call the gift that keeps on giving, because once you get it, you never get rid of it. And this thing keeps coming back over and over again. Things like hepatitis B or C that can cause liver damage over a lifetime, and that. Other infections, chickenpox. Chickenpox is something you get as a kid, and then that can go and cause another infection later in life called the shingles, and those are called chronic infections, and these are things that progress over a long period of time. Okay, all right. Now when we think about infections, we want to think about what do we see and what do we feel. Okay, and so this is where we get into the signs and symptoms. A sign is something you see. Okay, this is an objective sign. This is where a doctor or nurse will report it, write it in their chart, and say, aha, this person has a fever measured by their temperature. Okay, that is a sign, something that you physically can see. Okay, it might be redness on the cheeks or on the forehead and that stuff, and that would be a sign. A symptom is something you feel. Okay, that is something you feel physically. So let's say you feel you have a headache, you feel that. Okay, you feel that you're warm, that could be a sign of a fever. You could feel that you have the chills, you can feel that, type of thing. You can feel achy over your body, that is a symptom. Okay, so if you feel it, that's a symptom. If you see it, that's a sign. So that's the way I always think about it. You go and see signs on the highway, you feel the symptoms. Okay, so you feel the symptoms, you see the signs, and that's how I remember that. So if you remember those things. And again, this next slide just shows you the difference between it, and here's some different signs and symptoms, and you can see a lot of these things can also be symptoms depending on how they're interpreted. When I said fever, again, fever is something you can feel. You can feel warm, you can feel the sweat pooling down and that stuff. That is a symptom. But if you measure your temperature, that is a sign. So a physical measurement is a sign, because that's something you can report. But if you feel it, that can also be a fever as well. So some of these things can cross back and forth. But again, I'm not going to ask you, is this going to be a sign or symptom or something like this? I just want you to know the difference between what is a sign and what is a symptom. It's a great question to ask on the test. And so knowing what is a sign, what is a symptom, and again, signs are what you can see, symptoms are what you feel. Okay, looking at the list, fever, septicemia, microbes, abnormal chest sounds, skin eruptions, leukocytosis, leukopenia, swollen lymph nodes, abscesses, tachycardia, antibodies in the serum. These are all things we can measure, and measure using equipment that we have in the hospital. Symptoms are what you feel: chills, pain, nausea, malaise, chest tightness, itching, headache, weakness, abdominal cramps, anorexia, sore throat. These are all things we feel. You really can't measure them. They're very difficult to measure. You just know your patient will come in and say, I feel awful. I feel achy. I feel, itchy. I got a headache. I got weakness, all this stuff. Those are things you're going to see, that your patient's going to tell you, see. what you see is what you're going to use to measure. You can measure their temperature. You may see their rash and things like this. You may see some of these things, and that would be a sign. Symptom is what they feel and what they tell you they feel. Okay, so make sure you know the difference between the two. All right, so one of the big things that happens during an infection is inflammation, and this is your normal body response to an infection. And again, this includes things like fever, pain, soreness, and swelling. And we're going to talk about this again in chapter 14 about the signs and symptoms of inflammation, but I just bring this up now because this is typically what you feel when you get infected. Once the infection takes place, your immune system kicks in and you're going to feel these things. And so a lot of times we feel these things, and that is our signs and symptoms, okay? And that's all due to the inflammation in the immune system. So what are some of the signs? Well, you can have edema, you can have swelling, and so that's a huge sign. Obviously, you can see the swelling in the tissues. You can granulomas and abscesses. This shows you a granuloma in some liver tissue. So here shows you the liver tissue. It's being infected, and you can see that this is the infection, this is being walled off, and this is what we call a granuloma or an abscess in the tissue, okay? Lymphitis is swollen lymph nodes. Again, the doctor can feel those or nurse can feel those as you run your arm or your fingers across someone's neck. Sometimes in the armpit, you'll feel those as well. That is another sign that you're going to feel inflammation, so swelling in that. So, and we'll talk about this in chapter 14 again, but this is just something that you see with the signs and symptoms of inflammation. All right, so other signs and symptoms of the blood, again, leukocytosis. Leukocytosis means increased white blood cells. That's one of the first signs that doctors can see and nurses can see that a patient is infected with something is they do a blood draw. They draw the blood to see if you have an infection. And if you see more white blood cells than normal, that's a good sign that they have an infection going on. Other times infections can actually decrease. So if you remember, I talked about how white blood cells can be attacked by bacteria and viruses. Well, this is the case where you actually see fewer white blood cells. And so if it gets below a certain limit, we can say, ooh, this is leukopenia, and it's actually killing the white blood cells. Another sign of a disease. Okay. Obviously, if you have bacteria in the blood, this is going to be a bad thing. This is part of septicemia. Septicemia means microorganisms are present and multiplying. If you have bacteria in the blood, that means you have bacteria actively growing in the blood. And viremia means you have viruses growing in the blood. And again, multiplying in the blood, they may be a small number, but they're there in the blood. And typically your blood should be sterile. You shouldn't have bacteria and viruses floating around in that blood. So if you're a normal, healthy person, shouldn't have those things in there. All right. Now, sometimes infections go asymptomatic. And so, again, I was talking a little bit about STDs and that stuff. Sometimes these things get spread because people don't know they're infected. And there are certain diseases out there that have very few symptoms. And so, if you don't have symptoms, that doesn't mean you didn't get the disease. Okay, a lot of times we don't realize this, that, hey, I didn't know I was ever infected with this. They go in, get a blood draw, and then they find out they were infected with something as a kid, and they didn't know it because they never felt that disease, and that was asymptomatic. So if you don't show any signs or symptoms, that means asymptomatic. You were still infected, but you never showed any immune response to that disease, okay? And a lot of times interparent infections are ones that we don't seek medical attention because, again, we don't think that they're doing much. You may have a little headache, you may have some stuffiness or something, goes away, and then you don't bother even going to the doctor to do that, and that can happen as well. Okay, and that's called an asymptomatic or inapparent infection. All right, so once the infection is through with you, it needs to leave. And so obviously the portals of exit, how do these things get out? And so obviously one big way is through the respiratory system, through the use of mucus, sputum, nasal discharge, and saliva. So our coughing, our sneezing, and all that is a way for the microorganisms to get out of us as well and go and infect other hosts. And so one of the ways they do that is trigger us by making more mucus and trying to get those things out of there. Okay, skin scales, that's basically your skin sloughing off. And so if you have an open lesion that has an infection going on, that skin breaks off and can spread to other people. I've talked about MRSA before, how people can have skin-to-skin contact and pass that from one person to another. It can pass through your genital tract when you have urine or other things that are infected. And again, people mishandling it or things like this. Also, body fluids like semen and other things like that can spread disease, and again, sexually transmitted diseases. removal of blood, you have to be careful, use universal precautions that you don't poke yourself and that, because you think of that as infective. And then obviously feces and other things, lots of bacteria, lots of infection, potentially infectious agents in that. And so handling those things. And you guys are going to be at the front lines. You guys draw blood, you take samples, things like that. And when those are there, you want to make sure you use your universal precautions so that you don't get sick from those pathogens. Okay, so remember, pathogens are trying to find a new home to get you sick, and you don't want to be that new home for them. All right, now sometimes microbes will persist, and we have these things called latency. And we've talked about this with viruses, is that a virus can go latent. Well, bacteria can also do that as well, where they can go and hide and that stuff. We have several incidents where this can happen, but typically we're thinking of viruses with latency. So we've talked about this before with herpes virus, chicken pox, different viruses that go and hide. A lot of times what happens is the DNA or RNA gets integrated into the DNA or RNA of the host, and those things get integration, and then they hide for a long period of time. And then we have these periods where you have infection, then it goes away, infection again, goes away, infection again. Okay. Chronic carrier is someone who has a latent infection and is spreading the disease to other people. And so sometimes they can be asymptomatic, but typically there's someone that has the disease and passing it. So I would look at this as someone that may be HIV positive and then having many sexual partners and not telling them that they're HIV positive. That would be a chronic carrier because they're spreading the disease to unknowing people that get the disease. Now, squelae is anything that is basically long-term or permanent damage to organs and tissues due to that disease. So again, that could be a problem too, where if you have hepatitis can cause damage to the liver. That liver can then lead to things like liver cancer, liver failure, or other things, liver transplant, and those. So that would be a squelae, where again that lasts a long period of time after the initial infection. Okay, now I want to talk about sources and transmission. Well, there's basically two places that you get the infection. There's the reservoir, which is basically the primary habitat of where the microbe is. And so, like I said, in the first day of class, we talked about where microorganisms found: soil, water, and air. So that's their reservoir. Where are they found in nature? And again, I like this picture because this is really dirty water. I don't think anyone would drink that. But again, that would be the reservoir. These microbes are found in the water. Now, a source is anyone that's actually infected. Okay, and so a source would be you got the disease from this person because this person passed it to you and this stuff. Now, that person may have gotten it from the reservoir from either being in the spot where these things are normally found. So let's say that person drank some dirty water, got an E. coli infection, didn't wash their hands after they used the bathroom, then you got their infection from, and they prepared your food in the cafeteria, then you ate that food, now you got the infection. So that would be a source. You got it from the person, the cafeteria person, but the reservoir was the water that they drank that originally got the infection. And so that's how these things get passed. And so think of source as patient zero, or the patients that you get the disease from. Reservoir is where these things are found naturally in the habitat. Okay, and this can be human, animal, soil, water, plants, wherever this disease is found in nature. Source is who did you get it from? Okay. All right, we talk about carriers, and again, this is any individual who doesn't realize they have disease and carries it to other people. We have two different types of carriers. You have the asymptomatic carrier, where again, this could be they are in the infectious stage, or not the infectious stage, but that invasion stage where they don't even know, or incubation stage, incubation stage, they don't know that they're infected, and now they're passing it to people left and right. They're coughing and coughing in their hand, touching things, or just passing it, getting close to someone and breathing on them and that stuff and passing it. This is basically someone with no symptoms. A passive carrier is someone who basically is just a tool for the passage. So you go from one patient to the next. And again, this happens more often than you think in hospitals. Even though we think we're very clean and we try and change our gloves and wash our hands between patient and patient, sometimes it doesn't happen, especially when you're talking about traumas or an ER where you don't have a lot of time to think. You're going from one patient to the other, and this can happen very quickly. And this is called passive carrier, where the person doesn't get the disease itself, but he's passing it from one patient to the next, to the next, to the next. And this is an example of like typhoid Mary and that stuff, where she'd pass the disease from one person to another. And we'll talk more about that as we go along with the diseases. Okay. Other asymptomatic carriers, again, incubation carriers. These are people that are just getting the infection. They didn't realize it. I talked about convalescent carriers. These are ones that are recovering. They feel better, so they feel I can go back to work. But at that time, they go back to work and they still cause people to get sick because they still have the disease within them and they can pass on or the infection in them. And then a chronic carrier is someone who has it over a long period of time. Really, the chronic carrier in this case would be Typhoid Mary. She was actually asymptomatic. She was kind of a combination of all. So it was about this lady named Mary who was a nanny, and she actually harbored the typhus bacteria, the Salmonella typhi, in her intestine. She didn't know she had it. She just never got sick from it. But what happened is anytime she would prepare food or anything for the children, they would get violently ill, and it realized that they were thinking that she was a spreader, which she was. And so she was banned from doing any public service or anything else. Well, a couple years later, they found her again working at some other clinic and getting people sick again. So she was spreading the disease because she wasn't washing her hands. She didn't have very good hygiene. She was carrying the disease in her and she was passing it from one person to the next, to the next, and the next. And so that's what we call a chronic carrier, someone that harbors the disease and passes it to someone else during their time of infection. Okay, so you see that quite a bit. All right. So if a nurse transfers a pathogen between patients without becoming infected herself, that nurse is acted as what kind of carrier? A chronic carrier, a convalescent carrier, an incubation carrier, an asymptomatic carrier, or a passive carrier? What kind of carrier is that nurse? Okay, you said passive carrier, which should set you off as passing it from one patient to the next. That is a passive carrier. A passive carrier doesn't get infected, but is passing the disease from one patient to the other one. Okay, so if you said passive, good job. Okay, now animals can serve as reservoirs and sources, and so we think of this again, especially in the arthropod vectors and things like this. We call these things vectors because they bring disease. Again, a majority of the vectors we think about are the bugs or the arthropods. This includes fleas, mosquitoes, flies, and ticks. Again, we'll talk about some of the diseases that they spread here in the next couple of weeks. Again, some larger animals can also spread infection, including mammals. When we think of rabies, from animal to animal, birds can spread things, and lower vertebrates can also spread things. Think of salmonella in snakes and turtles and things like this because they harbor it in their intestines, and they can pass it if you have those as pets. Biological vectors are anything that participates in the pathogen's life cycle. So again, we'll talk about life cycles and that with pathogens, and some of these have multiple stages in their life cycle and that, and so those are biological vectors. So a flea with the flea with the I'm trying to remember, bubonic plague would be an example of a biological vector. A mechanical vector is just one that is basically transporting the disease. So a lot of times mosquitoes are mechanical vectors because they're just transporting the blood from one patient to the other, or one person to the other, I should say, and getting people sick. So a lot of times a mechanical vector would be the mosquito. A biological would be one that actually harbors and actually the organism grows inside of it. Okay, and we'll again talk about this again and again. And I just want you to know what a vector is. It just is something that spreads disease. Okay, an animal that spreads disease. Okay. And again, we'll talk about zoonoses. Zoonoses is basically a disease that's spread by an animal. And again, these animals spread to humans. Humans don't transmit disease to other animals. Typically, we don't have humans biting other animals or doing anything and passing disease. Most of the time, we are the end game. So once the pathogen gets to us, it stays with us. And then when it gets out of us, that's it. So we can spread it to human, but typically we don't spread it to other animals and that stuff. There are about 150 zoonoses, and again, exist worldwide, and they're making up about 70% of the newly emerging infections. And these are infections that are coming about from areas that we're getting into, like the jungles, and areas that are now being moved into by humans that weren't before, and now people are getting these diseases and that stuff. And again, it's impossible to eradicate things without getting rid of the reservoir. And so some of these things that we would love to get rid of, okay, like rabies and things like this that you really don't want to have around, we can't because we'd have to eliminate all the animals that harbor that. And I don't think everyone wants to see all the squirrels dead, all the rodents dead, all the chipmunks dead, and everything else. We need those things around. And then you'd also have to go after your dogs and cats because they can harbor rabies and then anything else. And so it's not one of those things that it's an easy problem to deal with. So A lot of times vaccination is the better way to go rather than trying to eradicate the disease one way or the other. Okay. All right. Here are some of the zoonotic infections. And again, you can see there's viruses, bacteria, and other things like fungus or parasites or protozoa. And again, we'll look at these things as we go along and we'll talk about where people get these things, how they get them, and that stuff. So as we go through these different levels and that stuff, we'll talk about these later on. But I just want you to be aware of where, you can get these things and where people and how you get them. Okay. So that's how that works. All right, and so the difference between communicable and non-communicable, communicable means it can pass from person to person. So when we talk about flu, that's a highly communicable disease because you can breathe on someone else and pass that to someone else, okay? Something like a skin infection is very difficult to pass to someone. That would be non-communicable. This is a disease that doesn't really pass from one person to the next, and so we don't think of that as communicable. Something that's on respiratory droplets that people breathe, that's going to be highly communicable because you can pass it from one person to another, and if it's highly, we call it contagious. Non-communicable is something like UTI. Again, most of the time, again, that's going to be from your own normal flora. That's where the problem's going to be, and that's not going to cause, you're not going to spread it from one person to the next. And so that would be a non-communicable infectious disease versus a communicable. Okay? And that's how we look at that. All right, and then again, patterns of transmission, we can get direct contact. That's actually breathing in those fine aerosols and that stuff. So you can see the sneeze down here, and all this is loaded with wonderful bacteria and viruses. Indirect contact means that it passes from an indirect host. So you can think of like doorknobs or door handles or something that people touch and that stuff, and it goes from one host to another. A vehicle is an inanimate material, food, water, biological products, fomites. These are surfaces and things like this, the dust in the air. Again, airborne, you have the droplet nuclei and aerosols and that. So all these different things are ways of getting the disease, okay? So typically, it's direct. If you have person to person breathing on one another, you get the direct contact or physical contact. Indirect is when you have, again, it passes from the infected host indirectly. So again, touching something and then another person comes along, touches it, and then touches their face and things like that. Okay, those are indirect contact that way. Okay. So how do we get communicable diseases? So again, you can see the direct contact. This would be either through kissing, through droplets. I like this person breathing on this person and that stuff. So that's how one gets spread. Vertical can be through the placenta, and then biological where you get bit by mosquitoes. And so that would be a biological vector, and these are all direct contact because basically the organism is passing it to you directly. Indirect would be, in this case, again, using vehicles, touching something like on a door handle. This would be preparing food, someone not washing their hands and then preparing food and not cooking it long enough and getting you sick. Droplet nuclei, maybe you're breathing it in, that's just in the air and being, a lot of people are coughing all around you and the droplets are filling the air and then you're breathing that in. Or sometimes aerosols from rodents and things like this. And so again, some of these viruses can actually be spread through rodent droppings and things like this. So when you have a problem where you have dirty hygiene and unclean places and things like this, you have hoarders and that stuff where they have books piled to the ceiling and they have mice and everything else, people can get very, very sick. So one of the things I always like to bring up at this stage is that show hoarders and that stuff. And there was a case where a number of people who went into that one of these houses to help clean up actually got sick from the hantavirus because they were breathing in the rodent droppings and everything else that were there. So that was particulate in the air, and they actually got sick. Now, the person that lived there didn't get it because they've been living with it for so long that it didn't really bother them. But people coming in and cleaning up the stuff disturbed the air. They were breathing this in and got really, really sick and could have died from just cleaning up someone else's waste. So there is that potential. So if you know people like that, you want to be very careful with going in and cleaning up and that stuff. Wear your mask and respirators and things like that when you go in. Same with like firefighters and first responders. That can be a problem too when you go into places and people are like that or in situations like that. They can get sick as well because of breathing in the air. All right. So nosocomial infections is an interesting one. These are infections that are acquired in the hospital. And so again, these are acquired during your stay at the hospital. And again, this can come from surgical procedures, equipment, personnel, exposure to drug-resistant microorganisms, and there are about 2 to 4 million cases of nosocomial infections every year. So this is people coming into the hospital with one infection and then leaving with another, okay? And they acquire this during their hospital stay. And if you look, 90,000 deaths, that's a lot of deaths that are caused by infections that they get in the hospital. So they're coming in with something else. They might come in with a heart problem. They had a heart attack and they leave with an infection. Or they might come in with, just they're going in for a routine surgery to remove something or do something, and they leave and they get an infection, and that could potentially kill them. We've heard about this with athletes and a number of other things where they get these nasty staph infections. So where do most of these nosocomial infections come from? Well, you can see most of them, about 40% of them, are due to urinary tract. And that makes a lot of sense because a lot of times what happens is when patients go to the hospital, they get put on catheters, especially like in the ICU and that stuff. They don't want them getting out of bed and going to the bathroom and that stuff. And so they put a catheter in. And anytime you introduce plastic into an area like that, you're bound to get an infection. So that's very typical. Urinary tract is one of these things that's very difficult to not get when you're in the hospital. Another one is a lower respiratory tract. Again, you're compromised because you're in a hospital. You're breathing in all this stuff, even though the air is trying to be clean. A lot of times you get different infections that can affect your lung infections. Okay, surgical wounds, that can be a huge problem. Again, this is typically, even though how well they clean the skin, sometimes the skin will carry those into the sites of the infection. Sometimes people that carry it, that maybe they didn't clean their gloves well enough or the tools well enough, and they pass it on, and that can be a surgical wound. There's a number of other ones: skin infections, blood infections, and then there's about 12% of other types of infections as well. And you can actually go and look. So if you're going to have a procedure in a hospital, you can actually go online and look to see how clean your hospital is. You can see their infection rates and things like this. And so you might change your mind in having a surgery done somewhere if their infection rate is really high, especially for those surgeries. So I highly recommend to do your research when you're doing that. If you're going in for a surgery that you need to have done and you're going to have it done at this place, I would check out their infection rate just to see how well or how dirty their hospitals are. And you can definitely change based on how well or how dirty those hospitals go. And it makes a lot of sense. Okay. All right. Again, here are the precautions for preventing nosocomial infections. And again, looking at these things, I'm not going to go through all these things, but again, you can see those things. We have the universal precautions, treating every fluid as something that's infective. And again, we use these things to make sure that we don't spread disease. However, they still happen. We still have 2 to 4 million cases a year that happen. We say, oh, we're clean, we're always clean, we wash our hands, but they still happen. And a lot of times, like I said, it's inadvertently and that stuff. It wasn't meant on purpose or anything like that. It just happens sometimes, and we see these things happen. And so, again, trying to be as clean as possible. We see this happen where sometimes people are just not following the rules, and it just happens, okay? And so, again, you guys are going on to these different fields. You want to make sure you use the right precautions when you're handling this different types of material. All right, and again, the universal precautions, these are the universal precautions here. Essentially, it's kind of the same thing that we deal with in the lab. Again, always wash your hands, wash down the surfaces to make sure those are clean. Treat any fluids as a biological material so that you properly store them. Make sure you don't spill them. Make sure if you do spill them, you report it, things like this. And so it's a lot of these things to say to stay safe. It's not only to keep your patients safe, but it ultimately is to keep you safe so you can keep working there and have a job. And so that's why you do that. And so with universal precautions, it's a basic assumption that everything is infective, okay? So no matter what, even if it comes from a clean person, you still treat that blood as that it's an infectious agent. It has some organism there that could potentially get you sick, okay? All right. So the last thing we're going to talk about real quickly is epidemiology. And epidemiology is the study of tracking and reporting disease. Okay. So these guys are out there to record, track, and figure out who is patient zero, where is the source, and where is the reservoir. And so they do a lot of different things. They do surveillance by collecting, analyzing, and reporting the data. They look at morbidity, mortality. They look at transmission rates, things like this. They report the diseases and all the reportable diseases. And again, we're going to look at this. There's up to about 60 identifiable and reportable diseases that they actually report on, have to get submitted every month to the public health. Those public health will then submit it to the CDC. And the CDC is ultimately responsible for all the things that go on in the United States. So the CDC is the head of all the tracking of the various diseases that happen in the United States. And again, we're going to get some experience looking at some of the charts in the CDC, looking at morbidity and mortality, and figuring out what those numbers actually mean. Okay, so that's epidemiology. There's, again, graduate studies and things like this. If you guys are interested, UWM offers a program in epidemiology. If you like statistics, tracking things, looking, who done it, the solving the mystery type of thing, this might be an area that you might be interested in getting into. So again, just putting the word out there that you do see this at certain places like UWM. Okay, so some of the terminology associated with epidemiology is the prevalence, and prevalence is the total number of existing cases. This is how many cases are out there in the US right at this time. So if you went and said how many flu cases are out there, you could get that number, and we call that the prevalence. Okay. The incidence measures how many new cases, so at a starting point. So you have to pick a specific date. So if we say from the start of the year, so let's say January 1st, 2016 till now, we could record all the new cases that have occurred in the flu. That would be an incidence, okay? So if prevalence is just looking at all the disease, and again, there's really no time period, it's looking at a percentage of the population. You could say from October till now, or whatever, that's the prevalence. The incidence is when you're looking at how many new cases of this disease has been reported for a certain amount of time, okay? And again, looking at a general healthy population. We also have the mortality rate and the morbidity rate. Mortality obviously is looking at death, how many people have died from this disease. Morbidity is just looking at how many people got sick from the disease. And again, we're going to be looking at this as this epidemiology report that I have you guys do. It's not really difficult. And again, what you're going to do is use some of the numbers looking at morbidity and seeing how many people actually got sick from a certain disease. You get to pick your disease and track the numbers for a couple of years. Okay, again, we can put the disease in a lot of different categories. You can look at the disease based on dates, how many people get it, the number of persons and that stuff, and track the disease. You can look at it versus states. You can look at it by age group, male and female. You can look at it by ethnicity. And again, all this data is collected so that you can come in and report how many people are actually getting sick. And you can break it down many different ways, looking at age, race, male, female, all these different things by state, by, region, all these different things. Or if you want to look at the country, how many as a whole are getting this disease. All this data is available to you through the CDC. And I'll show you when we get to the lab how that all works. Okay. Now, we also have some terminology to describe when we have abnormal amounts of disease. And so these are patterns of infectious disease occurrence. Sometimes we have what is called endemic, and these are where we have infections that are just normal for the course, where we get reported cases, and we've always seen these same reported cases over and over again. We call that an endemic area. So a lot of you guys would like to travel and go to places around the world. There are some areas where it's endemic to have these certain type of infections. And in order to go there, you have to get vaccinated for things. So like if you go to an area like in South America, a lot of times what they'll do is make you get vaccinated for yellow fever, because mosquitoes carry yellow fever. You don't want yellow fever. It's endemic in those areas. You find mosquitoes with it, and so you don't want to get it, so you'll get vaccinated to protect yourself. And that's what we mean by endemic. Okay, it's found in these areas of the country. Okay. Sporadic means you have different areas where you're getting a case or two that's abnormal popping up in different parts of the country. It's not something they worry about, but again, they see that these cases are popping up and they just want to report it to make sure and kind of keep an eye on it that it hasn't grown out of control. Okay. When you start to see things growing out of control, that's when you start to have what is called an epidemic. So when you start to see lots of cases occurring and actually beyond what is expected, that's when we start to worry. So this happens quite a bit a lot of times when we talk about flu. Flu starts to start as sporadic. It grows in different parts of the country. And then all of a sudden you start to see lots of cases in certain parts of the country really quickly. And then we call that an epidemic, especially happening more than what we normally would think. Okay. So last epidemic that a lot of you guys will probably remember is the H1N1. Okay. Here in this country, that was the last big major epidemic. Maybe last year with the flu, because a lot of people, even though they got vaccinated, still got the flu and that stuff. That would be another epidemic. Now, the last one is pandemic, and that's basically an epidemic worldwide. And so the last pandemic was the H1N1, where it spread throughout the world. Luckily, that flu strain wasn't deadly, but it could get people really, really sick. And so it caused a level 4 pandemic, meaning it spread through pretty much the whole world and that stuff. And we saw cases all around the world. It started in Mexico, traveled to the United States, and from there it kind of went throughout the rest of the world. And so when that happens, we call that a pandemic. Okay. And so again, these are going to be big numbers happening all around the world. Now, Ebola never got to that stage. Luckily, we did have an epidemic in Africa, and then we had a couple cases in the United States. Now, if it broke out in the United States, that's when we could start saying it's an epidemic here. And then we'd say that's a pandemic because it's happening in multiple parts of the world. But in this case, it was just an epidemic in Africa. We had a couple cases, and then it kind of went away after a while. Okay, and so that's the idea. All right, so the occurrence of Lyme disease, mainly in areas where certain people or certain species of ticks would live, would define it as a what kind of disease? An epidemic disease, an endemic disease, a sporadic disease, or pandemic. So think about where these ticks live. So that's the key in that phrase. Think about it for a second, and then I'll give you the answer. If you said endemic, you are right. So endemic is, again, found in areas where you see these things living, okay, the reservoirs. And so remember I was talking about yellow fever and how you might have to go get a shot. That is an endemic disease because that's typically found in mosquitoes in South and Central America. So if you go to those areas, you might have to get vaccinated for yellow fever because we know it's endemic to those areas. So good job if you got it right. All right, so we've come to the end. And so the first thing is the normal flora. Normal flora are microorganisms that colonize the body. And again, think about any opening to the outside world exposes us to microbes. And that when we first get born, that's when we first get our first organisms. And again, it takes us a while to colonize. And again, as we get older and more mature, we get more and more organisms. And those things change over time too. Our probiotics or our micro or our normal flora do change over time. It's not one thing that stays stationary our whole life. It changes with what we eat, where we go, and all these different things. And so it changes all the time. So what are some factors for infection? Again, what are the portals of entry? Anything that they can get into. And again, this is a major point. A lot of times microorganisms get in, but they can't adhere. If they adhere and stick to us, that leads us down the road to infection. So if they can adhere and get in, that leads to infection. You get disease, which can cause damage, and then finally portals of exit when the organism finally leaves. Remember your stages of infection. I love to ask questions about this, just like in the growth curve. So you have your incubation period. This is the time where you don't feel any symptoms at all. It's when you first come in contact with disease to the first symptoms. Okay, you have the prodromal. The prodromal stage is basically when you start to feel, I don't feel right. Okay. The period of invasion, this is when you now are at the height of the infection. You feel awful. You may be sleeping all the time, coughing, sneezing, doing all those things. And then you have the convalescent period where you start to feel better, and then once the symptoms finally go away, that's when you're done with the infection. The thing to remember, you are infectious at all these stages. So whether you're incubation all the way to convalescent, you can spread the disease to other people. So just remember that, okay, with that stages of infection. Okay, the signs and symptoms, remember signs are something you see, symptoms are what you feel. So you see a sign, you feel a symptom. So remember that. A source versus reservoir, this is a source where you get, a source is who you get it from. A reservoir is where it's found in nature. So typically we're talking about when we get things from other people, that's the source. We got our cold from Susie down the floor, or or someone else down the hallway type of thing. Whereas a reservoir is where these things are naturally located in the swamps, in the soil, in the water, and then we drink it and then we get sick. And so that's how we get sick, because we got it from the reservoir where these things found. Okay. The last thing is epidemiology. We talked about that. That's the study of tracking diseases. We talked about a lot of different things. Incidence measures how many new diseases or how many new cases of disease there are. Morbidity is how many people get sick. Mortality is how many people died. Endemic is where it's found locally. Epidemic is found, lots of cases in various parts of the country. And pandemic is epidemics worldwide. Okay? So we've come to the end of the lecture. I hope you got something out of it today. I know it was a lot of terms and everything else. Just keep it simple. Don't get bogged down with everything. Just kind of focus in on what I talked about in the summary and that stuff, and I think you'll be successful. If you have any questions, please feel free to ask me. Send me an email, stop me in the hall, come to my office hours and that. I'm happy to go over with the stuff with you at any time. Okay? Thank you for watching, and I'll see you next time.